us to be the recipient of the woven basket for the month of January. I've been the director at We Clinic since 2008 when Tina Welsh retired. And then Cassidy is our patient educator, and she also coordinates the patient escort program at our clinic. And then she also works for Pro-Choice Minnesota. So Cassidy, do you want to just talk a little bit about your role at the clinic?
Yeah. So my role as a patient educator is just to meet with all of the patients and help support them through their procedures and explain to them kind of the ins and outs of the specific care they're going to be receiving. So I really get hands-on experience with almost all of our patients, which is really great. It's one of my favorite parts of my job. And then as the clinic escort coordinator, I help recruit and train our clinic escorts to help make sure that when patients are coming into our clinic, we can mitigate some of that harassment and shame from protesters. So that's, I started at our clinic as a clinic escort, and then I fell in love with the staff in the clinic. And when I graduated, I asked if I could work there, and it's been wonderful. It's my favorite job in the world, is working at the clinic. I love it.
Well, and actually one interesting thing, and I'm not very tech savvy, but Cassidy has started a TikTok, I guess, program or whatever, videos, and they've gone viral around the world about the clinic escort. So maybe just talk a little, just say a few things about that. If people are on TikTok, they could look at the videos because it's been overwhelming, the support we've received.
Yeah. So I saw some other abortion clinics do this, and they film how their clinic escorts help patients get inside and just how intense it is outside of clinics. And so we took a jab at it and thought we'd try it. And we have, I think, 220,000 followers now. And we were able to create a Amazon wish list where people could just send us stuff. And our wish list sells out constantly. I mean, we're like walking around the clinic thinking of things that we need for this wish list, just because the support has been so amazing. So it has been honestly just huge for our clinic, is this the stuff that we're getting sent through the mail, and just the support where, I have messages from patients who are saying, I got an abortion when I was in college in 2010 at this clinic, and you guys saved my life. Thank you for what you're doing. It's just really, really cool stuff like that we're getting to see now.
And if anyone wants to look at the videos, Cassidy, where do they go?
Yeah, so our handle is Minnesota Clinic Escorts. Is our TikTok handle, and we just post videos of the protesters, really is what it is, just because the things they say are so extreme. And I think it invokes a sense of urgency in people. And so they really want to help support us to help mitigate that, which is great.
Yeah, so that's really been a wonderful addition to our clinic with Cassidy being able to do that. And like she said, people have been so generous. I mean, they've sent snow pants, boot warmers, hand warmers, umbrellas for the escorts just to keep warm during the winter. We use umbrellas to shield the patients when they walk into the clinic in case the protesters are filming them. They also will send snacks to the clinic escorts. And then just they've put in some things that our clinic needs, like sanitary napkins or maxi pads, copying paper, labels. So I mean, the generosity from people has been amazing. We had someone from England send us a box of red flare pens. So yeah. it's just kind of funny where all of the donations come from.
Yeah,
so,
it's been amazing.
And Cassidy, she has a PowerPoint that she would like to share. And so if you have questions as she's doing the PowerPoint, please ask. And others we can answer anything afterwards.
Yeah, absolutely. So ask as we go along, and I'm sure I'll need Laurie's help answering some questions, and then we'll pause for some questions at the end too. So I will share my screen here. Let's see. Okay, can everyone see that fine? Okay, yep. Perfect. So we talked a little bit about it earlier, but my name is Cassidy. I use she, her pronouns. I'm an abortion patient educator at We Health Clinic. I'm the Duluth Clinic Escort Program Coordinator. And then I am an organizer at Pro-Choice Minnesota, which was formerly NARAL Pro-Choice Minnesota. So I'm one of their new full-time staff. And today we're just going to talk about the state of abortion access in 2022. We're going to start with looking at what we're dealing with in Minnesota right now. And so we're going to go over our current abortion restrictions in Minnesota. There are 7 abortion restrictions. All of these are medically unnecessary. So that's why they're abortion restrictions, because they're medically unnecessary. And they're passed into law after being lobbied for by anti-abortion people and organizations. So they're to fit the moral agendas of anti-abortion politicians rather than for medical necessity. And then at our clinic, we actually see the direct impact that these restrictions are having on our patients, which gives us a really unique perspective when we talk about them, is because we're seeing the stories from patients as they're dealing with these. We're going to start with kind of our big one here, which is our 24-hour waiting period, but it's actually twofold. And so first, a patient must hear a state mandated script read by clinic staff. So if someone calls to make an abortion appointment, I have to read them a state mandated script while I'm setting up their second appointment that is also medically unnecessary. And at that appointment, a doctor must read them another script. And so that together makes up our 24-hour waiting period. The script that's read by clinic staff, some of the things that I have to say in it are, clearly a political agenda, but also can be triggering for some of our patients. So I have to say the father is liable to pay child support, even if the father offers to pay for the abortion. So that is clearly not very queer inclusive, because not just heterosexual couples are coming in to receive abortion care. And we also have to think of different situations that result in pregnancy and understand that this is not a sentence that makes sense for that a lot of the time. The other one is you have the right to review printed materials provided by the state. This information lists agencies with alternatives to abortion, information on fetal development, and information on fetal pain. We follow that up by saying this information is not related to abortion because it's not related to abortion, and then give the patient the option to see that material if they want to. But that's also frustrating to have to say to patients. That adds a lot more stigmatization and shame to their appointment. So I read that script to them and then I say, and, a doctor is going to call you on Monday evening between this hour and this hour. Make sure you have your ringer on. And then once they hear that script from that doctor, once that script is read, we have 24 hours that has to pass before we can provide them with their abortion care. The script that's read by the doctor, there's no medical necessity for, of course. And really the purpose of mandating an additional appointment like this, which ends up being a 24-hour waiting period, is to cater to anti-abortion political morals, but also to push patients further into pregnancy and keep abortion out of reach. So abortion is a very time-sensitive thing. And this is just adding a lot of complications on purpose to make abortion harder for people to access. So in practice, what we see is if a patient misses their phone appointment with the doctor, so that's the big one, right? If they miss their phone appointment with the doctor, we must cancel their appointment or reschedule their appointment. Now, this happens all the time. We say patient X did not receive their doctor phone call. We cannot see them this day. So we try to get in contact with them. We try to get another doctor to read them that information. And then from then we have 24 hours again that we have to wait before we can give them their abortion care. So what we really see is canceling their appointment. If they want to reschedule their appointment, we see that we have to reschedule their entire abortion appointment as well as reschedule their doctor phone call. And we start the whole process over again, which automatically just adds another week, which in a pregnancy, a week is a significant amount of time. The next one we have here, our fourth restriction, is going to be advanced practice clinicians are unable to provide abortion care. We see this in a lot of states, and it's really frustrating. So abortion care is well within the scope of practice of midwives, nurse practitioners, and physician's assistants. They're trained on it. They are very medically capable of it. And to go even further than that, this law also includes prescribing medication abortion, which is literally just providing patients with a medication. Medication abortions are completely self-managed. So it doesn't even go into skill level. It just is an abortion restriction. Other states such as Montana and West Virginia allow advanced practice clinicians to provide abortion care. So we see them able to provide abortion care in other states, and it really expands access. And we see the purpose of this restriction to severely limit access to abortion providers in general. So we're limiting who can actually provide abortion care. In Minnesota, we have 8 abortion providers in total, but only 3 that actually provide in-clinic suction abortion. So if you need an in-clinic suction abortion in the state of Minnesota, there's 3 places you can go to, and that is it. And we are very proud to be one of these 3 in-clinic suction providers is here in Duluth as We Health Clinic. So kind of looking at Minnesota, I made a little map here. The light purple is a medication only provider. And something that's important to understand too is you have to fit a very specific set of standards in order to qualify medically for a medication abortion. A lot of our patients will come in for a medication abortion, but actually need a suction abortion just because it's medically safer for that specific patient. And so we look and we see a huge concentration in the metro area. So 3 clinics here that can provide medication abortion, 1 in Rochester. And then we see our 2 clinics in the cities that provide in-clinic suction abortion, and then just us up here in Duluth. So we provide in-clinic suction abortion, telemedication abortion, where patients never have to set foot in our clinic, which is great for patients who are able to do that. And then our in-clinic medication abortion, which is they still come and see us and we give them an ultrasound in our clinic and they talk to the doctor in person, but they go home with their medication then. And then we have a mobile clinic in Minnesota, which is really cool. It's called Just the Pill. And so they're kind of everywhere. But for our in-clinic suction, these are your options in Minnesota. So we see a huge area that has no access to providers.
And actually, Cassidy, let me interject for a minute. Planned Parenthood in St. Paul is the only abortion provider that will go past 16 weeks in the state. And so we have noticed that they are really booked out. We've had some appointments or patients call us actually this past week that were past our gestational limit, and we go up to 15.6 weeks. So they were like 17 or 18 weeks in the pregnancy, and they tried calling Planned Parenthood and they can't get them in for at least 4 weeks. So I think, and some of the reason for that is they have a staffing shortage at Planned Parenthood right now, and also COVID, because some of their staff come down with COVID, and so then they have to cancel the appointments for the day because they don't have enough staff. So it's really sad that Whole Women's Health used to provide in-clinic suction abortions in Bloomington, but now they're not, and so that has really impacted people wanting in-clinic suction abortion appointments, because we've even seen people drive up from the Twin Cities area to come and get an in-clinic suction abortion at our clinic just because they can get in sooner at our clinic than down in the Twin Cities, because it's just Robbinsdale and Planned Parenthood in St. Paul that provide the in-clinic suction abortions down in Minneapolis.
Yeah, and Robbinsdale goes to 12 weeks in 0 days. And then we go to 15 weeks in 6 days. And then the Planned Parenthood, the Vandalia Street Planned Parenthood goes to 23 weeks in 5 days. So something I'd also like to note too is for unintended pregnancies, what we experience a lot with our patients is they're really unsure of their actual gestational age. And so we have patients who come in and think they're 6 weeks and they're really 12 weeks. And so a lot of this is just making it way harder for that patient to get their care in a timely manner and adding a ton of stigmatization and shame to them throughout this entire process. Our
We have a question from Will Munger. It says, if someone in Northwestern Minnesota needs abortion-related assistance, where do they go?
They can go to Red River Women's Clinic in Fargo.
Mm-hmm.
Otherwise, we do see some patients at our clinic, but most of them will go to Fargo.
Yeah. They'll go to Fargo, especially for in-clinic, but Just the Pill really focuses their care up here. That was part of the reason they started, is because of the lack of care up here. And I'm actually from the Iron Range, and I talked to Brooke during some random training that Just the Pill was at, and she was telling me about how they used to drive their mobile clinic up to Virginia every week to provide abortion care up on the Iron Range. And they're only providing medication abortion at this time. So our 5th law here is the parental notification of abortion for minors. We deal with this a lot at our clinic. Minors are mandated by law to notify both parents that they will be receiving abortion care. We must have written documentation of all of this notification, as well as written documentation that those people are actually their parents. So we get into a lot of issues with that. And it's important to understand that this law is required for all minors, regardless of their relationship with their parents. So this includes abusive relationships, no relationship with one or both of your parents. So maybe your dad was never in your life or your mom was never in your life. Doesn't matter. We still need written documentation of their notification. Maybe neither of your parents were in your life and your grandma raised you, but your grandma was never made your legal guardian. Same thing, doesn't matter. So the only alternative we have for minors, remember, we're thinking of people who are under 18, so they're, in high school, they're teenagers. The only alternative we have is to go through the court system. So they have to meet with a judge, who will then determine if they are mature enough to make the decision to have an abortion, which we always think on the abortion advocacy side is really ironic, because the alternative is to completely care for a child, whereas here we're determining if they're mature enough to make the decision to have an abortion. But that can be really, really, really scary for a lot of our minors. And we help them through that process. And we're very lucky to work with some great judges, but it's just really, it's really stigmatizing. And parental notification is not required for any other medical decisions related to pregnancy and reproduction, including giving birth. So this is something that is only specific to abortion to make it way harder for people to access abortion, especially minors. This makes it especially hard for minors. Our sixth one is mandated report of patient information to the state. Abortion providers must report a patient's age, the number of miscarriages they've had, the specific reason they're having an abortion, how they paid for the abortion. The patient's name is not attached to this information, so it's just anonymous. But these questions are intrusive, stigmatizing, and an invasion of privacy. So they come into our clinic and we say, hi, and you have a bunch of questions you have to answer for the state of Minnesota that have no medical necessity and don't make sense why we have to ask you them, but we do. So that's really frustrating. The Minnesota Department of Health will also report on patients' race, marital status, county of residence, and other things. That's just in the report that they give out every year. We see that that patient information is also displayed, again, anonymously. The patient's name is not attached to it, but they're recording all of those things just for abortion patients. So this data collection and reporting is separate from standard medical reporting protocols. We don't see this for anything else. We just see it for abortion care. And the last one is fetal tissue must be cremated or buried. This law is purely based on the moral beliefs of anti-abortion extremists, not medical safety protocols at all. But the implications of this is they increase the cost of abortion care, and it may go against just the general wishes, morals, or religious beliefs of a patient, is the understanding that that fetal tissue must be cremated. This one we see being really frustrating, specifically for religious beliefs for our patients. This one is frustrating. And then I'll shift gears here, and we are going to talk about, okay. Well, we're going to talk about SB 8, but there we go. Sorry. I don't know what was going on there. We're going to talk about SB 8. So SB 8 effectively bans abortion in the state of Texas. So we heard about this happening right when it came out. And so this is pretty complicated, but the Texas abortion ban bans abortion at 6 weeks or when cardiac activity can be detected. But it is more often than not by anti-abortion people called a heartbeat bill. And they say when a fetal heartbeat is detected, when the heartbeat is detected, this needs to be banned. But it is a 6-week ban is how we need to understand it. And so the New York Times had a great article where they really dove into every single piece of this law and described what was happening and why the law was passed in the way that it was. And so I took a quote here, and it says SB 8 defines a fetal heartbeat, which is not a clinical term. So that's why when they say it's a heartbeat bill, that doesn't make sense. And it's just a 6-week abortion ban, because fetal heartbeat is not a clinical term at this gestational age, as cardiac activity or the steady and repetitive rhythmic contraction of the fetal heart within the gestational sac. So they actually had to go on to define fetal heartbeat since they made a new term for this gestational age. This definition includes electrical activity in developing cells that starts at around 6-week gestation, though there is no heart at that stage of development, which is there's no controversy around that in the medical field. It's very clear what is happening at 6 weeks gestation in the medical field. And so I found that really interesting that it's called a heartbeat bill, but it's not. It's a 6-week abortion ban, but you're able to create a large campaign around, well, there's a heartbeat, right? So it made it to the Supreme Court. Supreme Court did not block it when it had the opportunity to. So this confirms our fears that the court will rule in an anti-abortion way, since there is a 6-3 anti-abortion majority sitting on the court. So this was the first thing that they had the opportunity to block, since it's a clear violation of Roe v. Wade that was not blocked, that they debated. And so really this foreshadowed for us the end of Roe, which we've all been thinking for a while, especially during the Trump presidency and the Supreme Court nominations that he chose. We knew that the end of Roe v. Wade was coming, but then the Supreme Court comes out and does not block SB 8. They're saying, no, SB 8 is constitutional, despite Roe v. Wade being there. Which brings us to Dobbs versus Jackson Women's Health Organization. So Jackson Women's Health Organization is actually the last abortion clinic in Mississippi. They're really, really cool. They do some really cool work. But Jackson Women's Health Organization sued the state over a 15-week abortion ban that was passed in their state. And they said, this is unconstitutional according to Roe v. Wade. The appeals process brought that case before the Supreme Court, and we heard oral arguments on December 1st. And I'm sure all of us kind of saw that happening. That was pretty big in the news. And we're expecting a decision by like June of 2022 of this year is when we're expecting a decision for that. But just kind of predicting here, based on the failure to block the Texas abortion ban, we know it's unlikely that the court will recognize Roe v. Wade and rule the Mississippi laws unconstitutional, right? Because they had that opportunity in SB 8 and they didn't. So it's very unlikely that they're going to do it for the 15-week abortion ban that we see here in Mississippi. So through this process, when they're looking at Dobbs v. Jackson, what they're really doing is re-examining Roe. And we're expecting that Roe itself will be overturned. Is they're going to say Roe was actually unconstitutional. When this happens, we fall into a pre-Roe era. So many states will ban abortion immediately, since between Roe and now, there have been trigger laws put into place. And trigger laws were set up when there was an anti-abortion Congress and governor's seats. And they were set up in the sense that they said, when Roe v. Wade is overturned, we'll make sure abortion's banned in this state. And then many states will, so those are the trigger laws, are where many states will ban abortion immediately. But if there's an anti-abortion majority in that state, they're expected to ban very quickly after Roe v. Wade is overturned.
And let me just interject. So
Yeah.
like in the Midwest, Iowa has a 6-week ban right now. Michigan has a pre-Roe ban. So that means that a law was enacted before 1973 and it was never removed, making abortion illegal. North Dakota has a trigger ban and a 6-week ban. And South Dakota also has a trigger ban, and Wisconsin has a pre-Roe ban. And the Attorney General last month from Wisconsin said he wouldn't enforce the pre-Roe ban, but we don't know if that will actually be true if something happens. So the states surrounding Minnesota would probably stop doing abortions because of these bans that they already have in their state if Roe is overturned. And Cassidy has a map now that you can see.
Yeah, so to back up for a second here, the reason that we will not lose our right to abortion in Minnesota is because of Doe v. Gomez. So in 1995, the Minnesota Supreme Court heard Doe v. Gomez and found that the constitutional right to privacy protects someone's right to abortion in Minnesota, which is actually what Roe v. Wade is based on our constitutional right to privacy. So when Roe v. Wade is overturned, we go back to a pre-Roe era. Well, our Minnesota state constitution protects the right to abortion. So we have the right to abortion in Minnesota despite Roe. And this lack of Roe means that individual states' governments decide whether or not people have a right to abortion care in their state, which is what Laurie was talking about. So we look, and Laurie had mentioned that, so all of these states, Laurie gave great specifics, have laws in place that were either placed before Roe v. Wade where it was enacted, or they're going to be placed immediately after. Which is really concerning. So all these orange states will ban abortion. And this is what we're looking at for the US for abortion access. So if you're here, I mean, where do you go? And then I'd also like to mention here that it really comes down to privileges. So do you have the ability to go to a state that can provide you with abortion? Do you have the money, the finances? Do you have the childcare? Do you have the transportation to be able to do that? And for people who with privileges, the answer is yes. For people who are underprivileged, the answer is no. And so that's what we see happening there. It's an important distinction to make. So when I look at the Midwest, we are going to be the only state that can provide abortion in the entire upper Midwest. And then it's Illinois. Minnesota and Illinois for the entire Midwest is what we're looking at, which is very scary. We are already kind of an island of abortion access, but it's us in Illinois. And I mean, we were just talking about how little access there is in Minnesota to begin with. And we're looking at being the only access for the entire upper Midwest. So, I mean, we talked about abortion. We look at this map here and abortion being safe in Minnesota, but is abortion actually safe in Minnesota? So despite the overturn of Roe, abortion is protected in Minnesota, but abortion is still super difficult to access. We have 7 significant abortion restrictions that you have to navigate no matter what. And then we only have 8 abortion providers, 3 of which are in-clinic providers. And so your options for abortion in Minnesota still are not fantastic. And just in 2021, a Texas-style abortion ban was introduced in the Minnesota State Senate. We saw it immediately. Of course, in Minnesota, that wouldn't be ruled constitutional because of Doe v. Gomez. But we see those efforts taking place, and we have to know that these don't go unnoticed. There's a lot of anti-abortion people in Minnesota, and so we're not guaranteed a right to abortion in Minnesota, despite Doe v. Gomez. We just have to hope that it stays. Currently, Minnesota has an anti-abortion Senate, a barely pro-choice House, and a pro-choice governor. But as we know that election is coming, or that his term is coming to an end. And so we really are trying to get a pro-reproductive freedom Senate, House, and governor, because then what can happen is we can get rid of those abortion restrictions and pass some affirmations, which means that we're going to be able to provide a lot more abortion care for all the people who are going to be depending on us pretty soon. And then finally, I'll just finish with how we can protect abortion in our community, which is what we really need to do. We need to focus on how we can protect abortion right here to make sure that we have our rights to reproductive freedom here in our community. And so currently, with the right to abortion still legal in all 50, so this is right now, We Health Clinic, other than Just the Pill, which is a mobile clinic, We Health Clinic is the only abortion clinic in all of northern Minnesota, all of northern Wisconsin, and the entire Upper Peninsula of Michigan. It is us in We Health Clinic. And then by the summer of 2022, we are expecting to be one of 3 in-clinic abortion providers in the entire Upper Midwest. That's immediate. It's overnight, we're expecting to be one of 3. So ways that you can help is to donate directly to our clinic. Donate to Hot Dish Militia, which is our local abortion fund. That just goes right to patients. And then other ways you can help is practice destigmatizing abortion in general. We have so much anti-abortion language around us. We want to put a positive light on abortion care. I always tell patients, we're so happy you're here. I'm so happy I can provide you with safe care. Because it's true, I'm happy that they're able to access our clinic and help them provide their care. Educate yourself on current events surrounding abortion care, especially as we enter 2022. Understand what's happening around abortion care. And then help elect pro-reproductive freedom representatives in the 2022 Minnesota state election, because we care about what's happening in terms of Minnesota nationwide. Is typically where the focus is, but we need to be protecting abortion access in Minnesota, because pretty soon it's going to be up to states. And then I just wanted to end us here with showing you all the services that we provide. So of course, we provide our in-clinic abortions, our medication abortions, and our telehealth medication abortion, which is new, and we're so happy to provide that. And then we have some of our that we've provided forever right here that you can read for yourself. And then trans and gender non-conforming hormone care, which is also newer for our clinic, and we're very proud to provide. But I'll turn it back over to Laurie. That's all I have for our presentation. Thank you all so much. I can stop sharing my screen too, so we can keep it to more of a dialogue.
So does anyone have any questions we can answer?
Mm-hmm.
Yes, Sally.
Sally, you go first. You can unmute yourself there. Well, while Sally's unmuting, I'll have a quick question, which is, I mean, does your clinic have the capacity to deal with helping all these people in the upper Midwest if and when that happens?
Probably not. We would probably have to hire some more staff. And right now we're having a hard time. We have a opening for an RN and we had 3 people apply. And then when we contacted them to come in for interviews, no, they weren't interested. So, so we're still trying to find an RN to work 1 day a week on the days that we do abortions. So if you know of anyone, but we, and then we have Dr. Judith Johnson, who's our medical director. So she would probably have to add another, day to her schedule during the week. So it'll be a growing and a learning experience for us too. Like once the Supreme Court makes their decision, how it's going to impact us and what we need to do to be able to offer the services that people deserve and that they need.
Can you hear?
Yeah,
Okay,
yeah,
can you hear me?
Yes.
Okay.
Yes.
My question is, if a person wants to volunteer, how do we do that? Do we talk to you, Laurie or Cassidy, or how do we do that?
Yeah, you can talk to either myself or Cassidy. And like, if you want to be a patient escort, Cassidy would be the person.
Okay.
And right now we're not taking a lot of volunteers inside the clinic because of COVID. But outside with the patient escorts, yes, definitely.
Okay, very good.
What
I have a
is
question.
the people that you have operating at the clinic?
I'm sorry, can you repeat that?
What is your number of staff that you have operating at the clinic and what roles do they show or work in?
So we have 2 RNs currently, and one of our RNs, so during the summer we have 3 RNs, but one RN is retired and she goes to Arizona in the winter. So we have 2 RNs. We have 2 people that work in our lab. We have 4 patient educators. We have an administrative assistant. We have an accountant, and then myself. And so most of the positions are part-time. So I work 40 hours a week. Our lab supervisor works 32 hours a week. Our administrative assistant works about 28 hours a week. And then our one nurse works 24 hours a week. And then everyone else just works 1 day a week.
Thank you.
I had a question. I was reading, in some media summary that the abortion ban was going to be very hard to enforce because of the fact that the abortion pills could be mailed to people, anonymously across the nation. It would be almost impossible to stop that. Now, I recognize there's a time limit on that, but what could you respond to whether you see that's something that is likely to happen or, ramp up if Roe v. Wade is overturned?
Well, the problem with some of the telehealth medical abortions is like in Wisconsin, by state law, you have to have an ultrasound before you can have an abortion. So like we can only mail the abortion pills to people that have a Minnesota mailing address. So when we set up their appointment, we ask if they have internet access and if they're in Minnesota. And then there's also questions and forms that they have to fill out to make sure they're a candidate for that type of abortion, because we don't want them to have a history of chlamydia and ectopic pregnancy. And we want to make sure that they're 9 weeks gestational age when we mail the pills. So there are certain questions, but yeah, and I think different states and different patients are trying to be creative and get the medication. When our doctor does a telehealth visit with the patients, she asks the patient, "Are you in Minnesota?" while she's talking to her. And the patient, says yes, because we know that they are. But that's one of the problems, is that some of the states have an ultrasound requirement, and some states actually have laws that say no telehealth abortions in our state. So that's limiting too. Even though the FDA approved mailing of abortion pills, some states now have laws that say they can't have a telemedicine visit in their state.
It's just, yeah, it seemed like what that article was saying is that there was just no way of preventing the pills being mailed, but then they wouldn't have the telehealth support, I guess, if you just
Right.
cut them. So there's danger in that. And then if there was a problem, where would they go? I guess.
Right.
Yeah.
Yeah.
Okay.
But we've done, we started doing telehealth visits, abortions in September. And I think from September to the end of December, we did about 28 telemedicine abortion appointments. And actually it was really nice because we saw some patients in Bemidji, some patients were actually in St. Paul, somewhere in Western Minnesota. So that meant that those patients did not have to travel to our clinic. And so they have a visit with our patient educator, and then they meet with the doctor by telehealth, and then we mail the pills. And we mail like a pregnancy test, the pills, and some medication for nausea, and some other just little swag things like a lip balm and candy. And that usually takes 2 to 3 days for them to get the medications by mail. So we mail it priority mail, and it comes in a box. And we're working on a really cute video that shows people how to take the medication, what to expect. It'll be a really good reference guide, but it's not quite done. And Paulina, who's our lab supervisor, she's the one who has made the video, and she's done a really amazing job. So it will be posted on our website eventually. She's just tweaking it. So that was one thing that we are really excited to offer this year. It's just the telemedicine medical abortions. And it's cheaper too than a regular abortion.
I had a question. What motivates you and your staff to continue, given the dire situation that these services are, that we're in with abortion rights?
For me, people have a right to medical care, to safe medical care. And, who would have thought 40 years later, we would be fighting these same battles, and it's gotten worse than when we opened our clinic in 1981. There's more laws, more restrictions, just more nastiness. We have the protesters that come every week. And I think people have a right to medical care. This is a medical procedure. They have a right to be treated with respect and be able to access it. And so that's what keeps me going. And also patients are so appreciative that we're here and that they can get the service. I mean, and we're not judgmental. And so many people, we see so many patients that say, well, I really don't believe in abortion, but for me, it's okay because my situation is different than the person next to me in the waiting room. And it's like, no, your situation is not any different. There's no right or wrong reason for abortion. It's your personal choice. So that's what motivates me. I don't know, Cassidy, maybe you want to.
Yeah, so I started as a patient educator, or as a clinic escort, just volunteering. And I think that for me, it's the patients, because I had this really amazing experience where a patient, like she asked if she could hold my hands, and she told me that she was really sad today because her brother was in a coma, nothing to do with her abortion, but her brother was in a coma. And walking through the protesters made it so much worse, but she was so thankful for me being there. And I'll never forget her, she was just crying to me about how thankful she was for me. And then so my job at Pro-Choice Minnesota focuses on a lot of advocacy. So I do a lot of the advocacy side of this, where I'm just fighting for abortion rights in general. But it's really the staff that we work with on both sides. Pro-Choice Minnesota, I work with great staff, but all the staff at We Health Clinic across the board, we all just want to provide that patient with the best care possible, just because we just believe in it. And we want patients to feel safe and comfortable, and every single person goes above and beyond. And all of us just, I don't know, I think it's just the work environment is just amazing. But it's really the patients. Like, you will never forget some experiences that you have with patients. And know that there's so many more of those to come. So I'll always keep doing the work. So I really like my perspective where I get the patient interactions, but I also have the advocacy work in general that I'm doing, but I get to see the direct help that advocacy is providing, which is really cool. But I think it also is knowing how bad the situation is and how important our clinic is here in Minnesota. I think also really, really helps, because we have to keep providing care because no one else is going to. Like, our clinic is extremely vital. So we have to keep providing the care that we do.
You know, and we have people that drive 2 to 3 hours one way just to get their abortion, and they come in bad weather, and you know, they take off work. Sometimes they don't have childcare. I mean, there's so many barriers too for them to get the care that they need. So that's one of the things that the patient escorts on their TikTok videos, we've gotten some like gift cards donated from Amazon, like a $25 gift card. So now we have the ability, if someone needs money for gas on their way home, we can give them a Visa gift card and say, go get gas. So
yeah, we hear that a lot, where this is my last $10, or, you know, I've tried to get here for 3 weeks and I couldn't because no one could watch my toddler. And just, you hear, like, it's just like real people going through regular life, and it's so hard for them to access their care that is like life-changing for them. They have to access this care in a timely manner. And what I like to think of too that really motivates me is the people who never got to our clinic or never had the opportunity to get to our clinic. Is, you know, we see the messages of patients who say, I'm so thankful for you. My life would not be the same. I wouldn't have the kids I have now if it wasn't for your clinic. And I think of the people who didn't end up having that and where they're sitting right now. And so I think that motivates us too, to try to do everything we can, like show on TikTok how hard it is to get to our clinic and how hard the struggle is to make it easier for other patients, for sure.
you know, we also are fortunate that in Minnesota, we have 2 abortion assistance funds. So our hot dish fund, which our clinic administers, we also provide funding for patients for abortion care. And then our Justice, which is down in Minneapolis, they used to be pro-choice resources. So that's a fund also that patients can access. And then if you're a Wisconsin resident, there's 3 funds that they can access. So it's the Options Fund, the Freedom Fund, and the National Abortion Federation Fund. And actually the Freedom Fund sends us like a specific amount of money for 6 months. And then we get to administer the money to the patients from Wisconsin. So it's easier. So like if a patient calls us to set up an abortion appointment and they say, I don't have any money, or do you know how I can help pay for this? We can say, hey, we're administrating this fund from the Freedom Fund, and we can give you $200. And then we send them a text and we'll say, here's other funding resources that you can access. And then South Dakota also has a fund. It's called South Dakota, South Dakota Women's Access for Everyone or something. And so they generally give between $100 and $150. So, you know, our clinic is fortunate that there are some funding opportunities for patients. And sometimes the patient will be able to get funding from different sources, so she doesn't have to pay a dime, which is really nice. Especially minors. Yeah. And especially at Christmas time when you know, people would come in and they'll say, you know, thank you so much for the funding. I wouldn't have been able to provide Christmas for my children, you know, if I had to pay $700 for an abortion. So
$700. Yeah. So it's like, hey, you need to come up with $700 in the next 4 days. Is usually what it is. And so it's really scary. So, I mean, our patients would not be able to get their abortion care if they did not have the funds with our abortion funds that are in place.
So last year we had, pardon?
Oh, I'm just saying we just have a minute left, and I think the Mungers had a question or comment. So you can unmute yourselves. I muted you, sorry.
Ask it.
I have a quick question, which is something I probably should know, but what's the connection between the health center and Planned Parenthood? And what is the total budget, and how much are you depending upon us for support?
Well, we have a really good relationship with Planned Parenthood in Duluth. And actually one of our former employees now is the clinic manager up at that Planned Parenthood, which is nice because she knows how our clinic works. and they make a lot of referrals. And we also have a good relationship with Planned Parenthood down in St. Paul, because some of our same doctors work and provide abortion care at St. Paul. Our budget is, let's see, last year it was a little over $700,000, and this year it's a little bit less. So, you know, really the donations that we receive from people, it generally just goes to operating support to keep our clinic open. So it pays for salaries, it pays for our malpractice insurance, it pays for the supplies, it pays for contraceptives. So, you know, we just are appreciative of any type of funding that we receive. And it's been really hard, you know, with COVID, we haven't had an in-person fundraiser for 2 years now. And we were going to have one this past September, but we ended up canceling it because of COVID. We didn't want to expose people. So we did a mailing instead. But yeah, so 2020.
Maybe the Unitarian Church could help in that. Hopefully we'll talk to you about that.
Yeah, okay. Yeah, hopefully we can have another dinner sometime.
Yeah. Something I'd like to mention too is like, I think I was under the facade of like, well, the clinics won't actually close. Like, I mean, we're always at risk for closing, but like, they'll never actually close. Us meaning like independent clinics everywhere. And then Whole Women's Health is closed in the cities. And we're down to 3 abortion providers in Minnesota. So it will happen is what's so scary. And that's why we depend so much on our supporters too. It's just because it's like, no, we actually could close one day. And so we really need to make sure that we're able to do the things like keep the lights on and keep the doors open so we can keep seeing patients for sure.
Yeah.
So
Financially,
I'm
No,
just
go
gonna
ahead,
say that
Kathy.
we're at wrap up, Lori, and then we're actually out of time. And we got.
I was just gonna say
Go ahead.
financially, it's hard to keep the clinic open. I mean, we're always short money and we don't get a big reimbursement from medical assistance. Medical assistance pays for abortion, but they don't pay what it costs us to provide the care. So anyway, you know, we're still open, which is an accomplishment, and we hope to be open in the future. So
Yeah.
thank you so much for
Thank you so
inviting
much.
us.
Yes. Thank
Oh,
you so much.
we want to thank you so much. This has been great. And as I mentioned before, this recording